It's a former artist.
All right.
School,
Okay, you hear that right? All right.
Alright, issues.
All right. Welcome to the pod. Val.
Welcome. I think this is the first official podcast we are having. Mine, sure.
That you were on the pod.
I'm on the podcast. I'm hosting.
Yeah.
So this has to be a special podcast for me like this.
Yeah.
We're starting this year cleaner, huh? Welcome, Josh.
Thank you.
Welcome, Mr. Andara. We're very happy to meet you. To have you on so it's not even a let's say a hot table and it's just a conversation table we call it. So thank you for having us. And we're starting with, I think, let's do a brief profiling of you. And I'll push it to you. Then you can do the overview profiling before we get into the main matters of the day today.
Okay.
So actually, we're having a. When I saw your profile, I was like, how long did you take? Because that profile has to be someone like 60 years old. Because the time limit that people will take and do all these things. When I saw it, I was like, oh wow. Like all this time, you just did. You were here. You are with the NIM. The like so many profile. Like I can't even get the entire grasp of it. So I will just put you on now. You just introduce yourself and let our listeners know who we are having today on the podcast.
All right. Actually, thank you for having me here. I'm really grateful to be featured in one of these episodes.
Nice.
My name is Andara Ali Mbishida. And, well, let me just say a little about myself. You see, let me say I school in Federal Polytechnic Bauchi, where I had my first diploma in crime management and control.
All right. Yeah, you can continue.
Yeah. Right. Right on.
Okay.
Yeah.
And then from there, I think I was able to engage in one or two things, and I think I work with a private school, which is it's not even inside the profile that I sent to you, but I think I work with one of the private school called Prepema.
Okay.
As a class teacher to their in their primary session, primary 3 precisely.
Okay,
I think that was like way back around 2007 or 8 so far. Well, I did that to support my education then.
Okay.
So I was like running it simultaneously with the diploma in crime management and control.
Yeah.
And then also teaching as a classroom teacher, because the program then was the evening course.
Okay.
And normally the lectures commence by 4 p.m. to 10 p.m. So that gives me an ample time to do other things. And then after that, I proceed to work with one European Union project called EU Insight.
EU Insight.
Yeah. Well, there's
here in Bauchi.
Yes, here in Bauchi.
Okay.
Is a European sponsored project. Well, it actually work with local NGOs, community-based social organizations. So it trains them on good governance and also community projects like that.
Okay.
Yeah, I happen to work as one of their, they call it field agents.
Okay.
Yes, in Bauchi. And then from there, I left that place when the contract expired or finished, because the project has actually come to an end. So from there, I was fortunate to apply with a HMO called United Healthcare International.
Okay.
We call it HMO, is a health maintenance organization. They are into health insurance. That was around 2012. Okay, because I was working with that EU Insight from 2008 to 2010. Yes. And then I started working with United Healthcare in 2012 as their office administrative. Sorry. Then I started as an intern.
Okay.
Yes, I started
They
as
take interim.
yes, intern. Yes.
That was after you're done with your school, or when you're doing your school?
Actually, intern is just like it's just a position that they give you, like you are getting an experience or something like that to help you in one of the things, like an office support or auxiliary staff, some people call it. And then from there, I went back to Federal Polytechnic to study public administration in diploma level again, because I've tried to apply for HND in public administration, but because what I studied then was crime management and control, so I wasn't able to get an admission. So I have to study diploma again in public admission and public administration.
Too many certificates.
I'm telling you. Well, from there, I think I'm still working with United Healthcare and then also pursuing my education. And then from there, I was able to proceed and into HND, and from HND to PhD. Now it's a postgraduate diploma still in public administration with the University of Agriculture, Makodi. And then working and studying at the same time actually helped me a lot, because you go to school, you come back, you practice actually what you learn in school in your working place. And I really love working with the private sector, because it actually boosts you, it helps you, it develops you. Yeah, we get to have a lot of training, a lot of sensitization, a lot of workshops, capacity building, and it helps a lot. And I was able to see a lot of things, learn a lot of things, go to a lot of places, get a lot of experience, also touch the life of people in some ways that I think I was able to do. And
is that how you got involved with NHIA?
Yes,
formerly known as NHIS.
Yes, yeah. NHIS was a program by the federal government. It actually is a health maintenance organization program, or shall I say health insurance. So actually, government is trying to see how it can help families and individuals with the financial burden of health care and health maintenance. So it comes up with this plan of health insurance, which is a pool of resources that you put together in order to help individuals and families access it in the times of need or medical services when the need arises. And NHIS works with what we call health maintenance organizations, which are companies, private companies that actually are engaged in providing those services to people. And the thing is like a tripartite relationship, where you have NHIS at the top as the regulatory body, which is a government institution or agency, or you can call it parastatal. And then you have the health maintenance organization, who are actually involved with the health insurance programs. And then you have the healthcare providers, which is the hospital also, which also help in providing those services, which are in direct contact with the enrollees, or say the patients. So that's how it
goes down to the root, like to this, like the community based.
Yeah.
Like the NHS can touch, like even the primary healthcare we're having here.
Yes.
Because I can remember, I think it's NHS that was something like this. I had insurance with them. I don't know whether it's the NHS, but I think it ran out when I become of 18 years, I think. So yeah, so like I couldn't access it again.
Yes, that is a policy. Okay. You see, NHIS actually, when it first comes on board, I think it started in 1999, 2000. And first, the federal government start with its employees, which is the federal government workers. So anybody that is employed or working as a federal government worker is will register under NHIS.
Was it compulsory?
Well, when it started, it wasn't compulsory.
Okay.
Yes, it wasn't compulsory. And then government was even test running it, because it was even providing those health insurance free to its workers with a target.
It started as a pilot
Pilot study.
Project.
Thank you. Yes. And they want to make a pilot study of it for like 5 years to actually create an awareness and to see the how people accept it. And then from there, then it will start deducting from the salary of those people, because, as I said, it's a pool of fund. So that means that you pay fund and then others can access it, and you also can access it when you're sick. So federal government started with the federal workers for that pilot study. And what happened was that once you are employed as a federal government worker, you are eligible to access health insurance services then. So what actually happened is that you go to health insurance offices, you register, or you go to the HMO that is being assigned to your organization, agencies, or parastatals, or even department. And then we are having more than 80 HMOs. HMOs are called Health Maintenance Organization.
All right.
And then we call the hospital healthcare providers. And then we have NHIS at the top. And
what are those HMO?
well, HMOs, as I said, they are private organizations that the NHIS accredit them to provide these health insurance services. Because NHIS is like the regulatory body. Is a body, is an agency, a parastatal that's been established by the federal government.
Okay.
Yes, to provide this framework, to provide the policies, the guides, the guideline.
The HMOs, they provide the services.
HMOs provide the services in hand with the hospitals. So actually, what happened is that the HMOs are the one that they registered their enrollees, that is civil servant, federal civil servant. Okay. There's a form that has been made, that has been prepared. You come, you fill the form with your passport and your dependents, 4 dependents, biological dependents. The spouse, which can be a male or a female, depending on who is working then. If it is the husband that is working, is the principal enrollee, and then he now register his wife, which is the spouse. If it is the wife that is working, she's the principal enrollee, and the husband is now the spouse. And then they register their 4 biological children. And those children should be below the ages of 18. Once a child,
I think that's my own.
It happens that one of your parents is working as a federal government worker, so he register you as an enrollee, or she register you as a dependent on that. And then the moment you reach the age of 18, the system would automatically
pull you out.
Out of the system, because it's believed by then you should be in higher institution, which that is another provision for health insurance for students that are in tertiary institution.
I think I was a beneficiary for both.
Really?
Yes. my dad works with TH. Used to work with TH. So I was a beneficiary as an under 18. And then in the tertiary institution, I was also a beneficiary.
So you went to tertiary institution when you are under 18?
No, I mean I was a beneficiary with the under 18.
Before
tertiary institution.
I understand. Yeah. That's very good. You know, actually, when you are into the system, that is when you appreciate the beauty of it. Because as I was saying now, you register as a federal government worker. When during the registration, you don't, as a federal government worker, you don't choose a HMO, because HMO is automatically assigned to your ministry or your department or your agency or your
I noticed that the one in tertiary was different.
Yes.
From the one at TH.
It's part of the programs. Look, the one that I'm talking about is the one that we call the formal sector social health insurance system program. And then after it, we have the T-ship called the Tertiary Institution Social Health Insurance Program.
That's for the students.
That is for the student. And then apart from that, we have another one called VC-ship. When VC-ship started, it started as a voluntary social health insurance program. Later, it was changed to vital social health insurance program. And then later, they come up with another one called GIFT-ship. That is Group Individual Family Social Health Insurance Program. Now, all those things, the federal government is trying to see how it can reach this universal health coverage plan for Nigerians, because up to now NHIS is not able to cover the whole of Nigeria. I think back then when I was in school, I think one of my project that I did is on this T-ship. in Federal Polytechnic.
Okay.
Student in Federal Polytechnic. That's my diploma when I was in diploma. And then when I did that project, I think the total number of people that are covered under under health insurance in Nigeria is just around 5%. Out of 100. Just imagine, just 5%.
Because I was trying to even get to that. So like, there are the sensitization for people.
Thank you very much. NHIS has really tried with the sensitization and many programs and many workshops like that. And we are still doing it.
From back then, from the 5% when you did your project to now, how large has the number come up?
Well, now actually I don't have the exact figure, but I know there's an increase, a very good percentage of increase on that.
Okay. I want to ask this question.
Okay.
Although you started touching it, the issue of, you said only 5% of Nigerians
Yes
were enrolled.
Yes, but
on national health insurance.
Back then, right?
Yeah, that was back then. That was
then the population of Nigeria was 60, 80, or 120 million.
Well, then we are talking about 120 million.
120 million.
Yes.
Okay.
So it's not even up to.
Because then, believe me, the number of people that are covered is just the few people that are under the organized private sector health insurance programs, and then the federal government workers. I think those are the only people that are covered. And there are just, I think then, how many states were doing even health insurance project? I think it's only Rivers State and Bauchi State then, under the governorship of
Mwazu?
Was it Mwazu?
Or Isa Yuguda?
I think it's Isa Yuguda. I think it should be Isa Yuguda.
2009, 10, 11.
Yes.
Is Isa Yuguda.
Yeah, it should be Isa Yuguda, yes. And then I think it's Rivers State. I think there are only 2 states that were doing that project then. That is the state social health insurance program. Because actually, apart from the federal government NHIS that we're talking about, that is what we also call state social health insurance program. This one is managed by each state, the 36 states. So they are also having their own agency. Just like at the federal level that we have the NHIS, the state also have their own. Like Plateau State are having their own. I don't know the name. Is it Plateau? I can't remember the name. But I know that of Gombe State, which is called Go Health. And then Bauchi is also having another one that is actually working. And I think it's like they are more into this basic primary healthcare services called Bashma. Their own agency is called Bashma. And then there are other states like I know Abuja are also doing it. Lagos are also doing it. So, the programs, there are varieties of programs. Nigerians were very good in making policies, good policies.
Yeah.
Just the issues at times we have is implementing those policies. So, and then as I'm saying, now we have what we're even talking about. I don't want us to just be talking randomly. I would like us to take a program, for instance, and then discuss it. So, just
like I was saying, my question, I wanted to ask a question, and then it led to another minor question. What do you think is the problem with the percentage, like you said, 5% out of 120 million people that was back then?
Yes,
accepted it. What is the percentage of growth to this moment?
Okay. Well, actually, I haven't looked into that, but believe me, I will do that for you.
Okay.
But what resulted this poor percentage in the registration, or why people do not register, is actually lack of awareness. And then at times, as Africans or Nigerians, we have kind of a belief, I don't know, people believe like, if I register, it's like I'm causing myself to be sick.
Yeah.
There was a particular person that told me this. Look, believe me. There was a time that my HMO were given deadline by NHIS to do a mop-up registration to capture all the civil servants, federal civil servants that have not registered, so that now they should register. Because then it was NHIS National Health Insurance Scheme. Now the name has been changed to NHIA, National Health Insurance Authority. Now they have been given a kind of a backup, a kind of a power, understand, to cover the whole of Nigeria. So now it's like a compulsory for a federal government worker to be under that scheme. Yes. Because federal government understand that Nigerians, if you do not make something compulsory, we hardly do it.
They won't do
and we like doing things at the rush hour. So what I'm trying to say is that this guy, I was in their weekend place for 2 weeks trying to do a mop-up registration. This guy refused to register. And I was asking him why. He said that how can he go and start registering for health insurance when he's not sick? It's like he's praying or he's cursing himself to be sick or any member of his family. That sickness and health come from God. Whether you'll be sick or you will not be sick is God that will warrant that. So he see no need that he should register.
Okay.
And then there's something happens with another person. Let me those people, it's not that they are not aware. Believe me, NHIS have done a lot. The HMOs, that is the Health Maintenance Organization, are also doing a lot, because I know that my HMO, we're organizing a sensitization every year. We call it a workshop for our enrollees that are under us. We give them a sensitization awareness. We tell them a lot about the scheme, how they can access it, their rights, and many other things, the advantages.
With all these things you've said, what do you think is the problem? Since, okay, you say the HMOs and the agencies are carrying out sensitization and programs, but it seems like it's not working.
Well,
what do you think the organization need to do to combat this issue? Because it's obvious that Nigerians don't really care about insurance. Even when it comes to insuring your money or your finance, it's difficult to find people to register. So what do you think is the way out?
Well, you see, actually, what actually happened is people are having poor knowledge, or people are unaware of the services of those programs out there. That is the main thing. And even people that are aware of it, most people complain of the prices. Shall I say the economic factor of the country? We are having a very poor economic in Nigeria, whereby somebody will tell you, wow, how many times do I used to get sick in a year? Is it not only malaria and then maybe a cough or something like that? I'll just buy drugs in the chemist. That's just the belief. But believe me, now with your 15,000, then it was even 12,000 naira. But now with your 15,000 naira, you can be covered for 1 year.
15 per year?
Yes, 15,000 naira per year. And you can pay for, like, now under the GIPSHIP that I'm talking about, that is the Group Individual Family Social Health Insurance Program. Now it comes out with that, with this particular program, that but the issue is that you cannot register only you with 15,000 naira. The minimum you pay when you are going to register is 45,000 naira. Okay. But once you register with that 45,000 naira, you have a window to add 2 more people.
Okay.
But as a family. Now, under NHIS, when we talk about family, we are talking about 6 people: a principal, a spouse, and 4 biological children. So if you are going to register a family,
is that the standard for a Nigerian family?
Well,
6.
Yes, that's the standard. In fact, I think even globally, worldwide, that's the standard. At least
family of 6.
Family of 6, at least. The principal, the spouse, and 4 biological children. Now you pay 60,000, and then it allows a group of 10 to also register, with each member paying 15,000 naira per annum, and you are covered. You enjoy all the services.
And you don't have to be a civil servant.
You don't need to be a civil servant. Look, this GIPSHIP that I'm talking about, it comes with the idea of universal health coverage. That is, every Nigerian, there's a need for him to be covered under health insurance. Be it whether you're a federal government worker, or you're a businessman, you're an Akada rider, Akara fryer, you're a mechanic, a vulcanizer, or anything. Whatever you're doing, you can be health insured. This financial hardship that you have to go, Because actually, sickness will not knock on your door. It will not give you a notice that I'm coming in the next 2 or 3 weeks.
Yeah.
So anything can happen. A road traffic accident, just anything. So that's why there's need for you to be health insurance because of the rainy day. Be prepared for the rainy day. Now, let me give you another a scenario. What happened? There was this guy. During that mop-up registration, I went to their place, to their ministry, to their agency for 2 weeks. Believe me, this guy refused to register. One day I was sitting in the office and he came in. He met me. And he told me that he wanted to register under NHIS. Then we are still doing it on paper. We are still doing the hard copy. Before now it's actually digital. You register online.
Nice.
So he told me that he want to register, asking his place of work. He told me he come with all the necessary things because he is aware. He know the procedure of the registration. So I register him. And then when you register him on the form, there's the NHIS number that he will use it. So because he will use that number to come and check whether his name is out. Because once you register, it takes 90 days waiting period. That is 3 months before your name will be registered, will be captured under the database. Because actually NHIS release those name or update those name after 3 months, which is quarterly in a year. And also that is what we call capitation that they pay to the facilities.
Okay, I thought it was because of the process, the manual process.
Well, actually, if you allow it to be so open, there will be update every day because people register every day. But to make it to be more flexible, so NHIS make it after
3 months.
3 months.
Till date is still 3 months.
Till date is the 3 months. Okay, like if you register now, this is February, right? So hopefully it is not going to be up to 3 months because the next list will be coming in April.
Okay, so
it's
standard every end of quarter.
After every quarter.
Okay.
Yes. So, but if you register in April, first week or second week of April, that means you have to wait until August.
Yeah.
Or July, until July, right? July is the next quarter now. Yeah, until July, then your name will be out. So that is how it is. So at least they give you 90 days waiting period. At times, it's not up to 90 days, depending on the time that you register. But those lists are released quarterly with update because at times you find out that others make a new registration, others they add their dependent, others want to change their hospital because there is a room for that. During the registration, you register, you choose your healthcare provider, which is your hospital, and then you register your children or your wife or your husband, depending on your gender. And if, for example, you are single, you are not married, you registered only you. So by the time that you get married, you now update it. Thank you very much. You update it. That is by registering your spouse or your wife or your husband.
On the same subscription you did?
Yes.
Or you have to subscribe again?
Well, it depends on the plan that you're under.
Okay. Another question is, I think a lot of people don't know much about, because anytime maybe there is a sensitization, the people or your organization normally talk about people should register. They don't really tell people the importance of getting this health insurance. What I mean is, for example now, what kind of sickness is covered? What kind of medical expenses will be covered? How many percentage? Is it for free? How many percentage will be discounted? Stuff like that. For example, me, I don't even know that.
Okay. You see, I was actually trying to give you one of my experience with an enrollee. This guy did not register. He came to my office. You want to register? I registered him. I registered his wife. Excuse me. I registered his children. After the registration, I told him that this is your NHIS number. You come back after 3 months, check if it is out. You give me this number. This is the number that I'm going to use to check whether your name has been captured under the database. After we finished, then he told me, okay, can he take this number now to the hospital? I said, for what? He said, so that they will remit my money to me. I said, what are you talking about? That his wife has given birth in the hospital. Typical CS.
Typical Nigeria.
True CS. And then now, and he paid it out of pocket. So now he want to register and take that number back to them so that they will pay him back his money. I say, Chairman, wait, sit down. It's like we need to have a conversation now.
He is not aware.
Yes. So I asked him, actually, tell me what is the matter? What is happening? And because when he came, I was surprised. I said, how comes? I spent 2 weeks in this place, going to your working place. I thought I cover everybody. Are you newly intake or are you transfer? He told me, no, he has been here, that he has even been seeing me in the office. I said, then why didn't you register? He couldn't explain. I said, okay. I said, now tell me. He told me that, well, actually, he don't believe in this health insurance. That's the truth. He don't believe in health insurance. But what happened was that his wife was pregnant. She did her antenatal. And this, it was in Ni'ima Consultant Hospital, Bauchi, that his wife gave birth there through CS. And then he paid a lot of money. I think then the CS was around 120,000, which he paid. And then they were in the post CS ward or whatever they call it in the hospital. He was there. And it so happened that the next patient that was hospital or was given birth next to his wife was also a staff, his colleague from their place of work, the same place of work. And then he was complaining to the colleague about how expensive the CS and the medication and other things like this. And the colleague was surprised. Expensive as how? Me, I just paid around 3,000 naira. The guy was surprised. What? I paid more than 130,000. You're telling me that you paid around 3,000? The guy was surprised. Then he told him, but didn't you register on the health insurance? He said, me, I register on the NHIS. What about you? The guy said, no, I do not register. And the guy told him, well, on the health insurance, I only pay for 10% of my medication, and that is all.
I know, I can attest to that.
So that was what prompted the guy to rush to our office, come and meet me that registration and say, Chairman, there is no magic in this thing. You have to wait after 90 days.
In essence, sir, what you're saying is 10%. You only pay 10%.
Okay, how the scheme works is that, you see, consultation is free once you register on the NHIS.
Okay.
You know, now consultation in our hospitals is around 2,000 to 5,000. Even to see some specialists is around 8,000 naira to 10,000 naira. Depend on the facility. You understand? Just for you to see a consultant when you go to the hospital, you pay this price. But under NHIS, there is nothing like that. It's free. And then now, if you are going to the hospital, that is what we call the opening of file. You know, you pay money to open a file.
Yeah.
Depend whether individual or family file. They have that. It's also money you paid. Under NHIS, you don't pay anything. They open file for you and your family free. As long as you're having a NHIS number, they just verify you're covered. It's okay because NHIS send the list to the facilities of all their enrollees. That is people that are registered under NHIS that choose that particular hospital. So NHIS send the list to those hospitals so that they will have a verified number of people that are in their hospital. Now, apart from that, you run some tests there, free. They don't charge you. The hospital, if you are sick, whether you have been bed, they give you bed in the hospital, it's free. Understand? Though it's for 21 days in a year. Okay. So you're entitled to be hospitalized or to give them bed in hospital for 21 days in a year. That is a normal sickness. But in the case of orthopedic, I think it's more than that. It's around almost 30 days or so. Okay. I think it's around 4 to 5 weeks for orthopedic cases, because that's we are talking about fracture. You know, it take time. So and then once you have been seen by the doctor, you run some tests or whatsoever, and they issue drugs to you. So you pay 10% of the drugs that they paid you, that they issue to you, that they prescribe to you.
Okay.
Yes. There are drugs that are covered under NHIS, and there are other drugs that are not covered under NHIS. And the issue that we're having is that some people prefer branded drugs that they have these big names. Well, NHIS actually go for generic drugs, and then they provide the same thing. But it's just that at times people prefer some drugs to other drugs.
More popular.
Thank you. That are more popular.
What about over-the-counter drugs?
Yes. Well, that's another way of saying it. When there's two drugs. So you only pay 10%. And then we have issues, people complaining that the hospital overcharged them. Well, we tell them, if you have a complaint, you there are procedures, there are laid down room
Okay.
guidelines for you to channel any complaint, any grievances. Or
What
anything.
about surgeries and some medical procedures?
Well, like I said, now you see, the person that I've just told you about, his one was CS.
Yes.
Is covered under NHIS.
Okay.
Even appendix is covered. Road traffic accident is covered. Okay. Some of the things that are not covered are all these cosmetic surgeries. It's not covered. All these
What's BBL?
thank you. And then,
BBL is covered.
Everybody's
and then some accident that you sustain in some extreme sports like boxing, wrestling, racing, car racing, horse whatsoever. This one they are not covered. All these epidemics they are not covered. Riot, you have those things like those, they are not covered. And that's just it. Actually, when in the case of epidemic, government actually intervene. There are some plans for it. And then there are other cases that are not covered, like all this injury that you sustain in your place of work, because there are laws that govern these ones.
Okay.
Once you're working, there is a law that governs you that if you sustain injury, some degree of injury in your place of work, the place of work will have to come in and take care of you. So stuff like this.
So
okay.
In the part of, I can see how dire and important this is, because me, I've experienced the personal harm, and my family has experienced the NHIS this thing. And I feel like a lot of people around here, like in the primary health sector, we don't have a lot of people that enroll in that. So the objective, let's say yearly objective or monthly or quarterly for the NHIS, how important is it for the NHIS to bring the sensitization to the primary health sector? Let's say like this, our health sector here in what's it called? Yellow here. Because you go around here and you see most people that they're there looking for alternative. Okay, but they're sick or all this sickness, and most of the times they don't even know that these things are around for them. And in the primary health sector, I think there's supposed to be someone that will like, okay, since you guys are having this issue, you should register on so platform so that things will be better. Maybe next time.
Yes, I agree with you. Believe me, I've done a lot of sensitization in this area. In fact, I even help in helping other people to register that are not even covered under my HMO. That is the people that I'm covering. I even help a lot of people add their dependents, help a lot of people change their hospitals, things like that. Because I understand that people are still unaware of this program. And it's a very wonderful program. People are still unaware. Believe me, you see, NHIS designed it in a very good way. In the hospital, we have levels of services. We have the primary services covered by primary providers, secondary services, and tertiary services. 3 levels of services. Now, under it, we have hospitals that provide those services. Now, a hospital will actually express their interest to NHIS that they want to be part of the policy, part of the program. Yeah. Okay, so the purchase form, or they paid for with the NHIS, they give them form, they register. The NHIS will go to the facility, that is the hospital. They will go and check the hospital. They will do what we call quality assurance, and then they will then accredit the hospital based on the services that those hospitals will provide, based on the manpower, the people, the specialists that they are having in there. So actually, we have the primary services which primary healthcare providers provide. That is hospital that provide those services. And then after it, we have a secondary services which a particular hospital can provide these 2 services, a primary service and a secondary service. And then we have the tertiary services, which actually I think we have a number of hospitals here that are providing it, like the ATBU Teaching Hospital is a primary, secondary, and tertiary hospital. The state specialist also, NEMA also. We have FMC Azure. They also provide this tertiary services. And then the way NHIS designed the thing is that they want it to be more flexible, more convenient, more comfortable, more easy for people, in such a way that if you're sick, you can be able to access medical services somewhere closer to you. most especially in the cases of emergency, instead of going to a very distant place. So why not find a facility or a hospital that is in your neighborhood that is being accredited by NHIS? Choose it as your primary provider, because most of our sickness is malaria, typhoid, and then all those things are minor ailment that can be managed at the primary level. So once it goes out of primary level, if they need a further treatment, that is what we call referral. That is when they refer you to a secondary services, and then they provide the secondary services to you. But if it is a case that is beyond secondary services, they now refer you to a tertiary institution where they provide those services to you. Now, you see, as I was telling you, people are unaware of this program. Do you know that there's a hospital that we have here, this place that we used to do this crossover, there's a hospital there, Woodum and Wayo.
Dr. Zaka.
Dr. Zaka. Yeah. Yes, that's the name of the doctor. But the name of the hospital is Woodum and Wayo.
Yeah.
This facility, this hospital, is providing NHIS services. And I keep telling people, especially people that are here in Yelwa, why would you choose a facility that is far from you? Like now, just because you are having a fever, you are running a fever, or your child is running a temperature, or is having a catarrh, or is coughing, or things like this, and then you start burning your fuel, or start paying transportation to go to Angolebra, or to go to TH, or you go to town. Imagine the money that you are going to pay. So people, instead of paying that money, they will prefer to go to a chemist and just buy medicine, which is highly discouraged. You don't just go to the pharmacy store and buy drugs. You need a medical practitioner to check you, to know what is wrong with you, actually, if possible, to even run a test. Because it's not any drugs that you take that will actually treat you. Actually, they have to understand, if it is even if it's antibiotics, they have to understand the nature of that bacteria that is inside of you, which antibiotic to give you. How will they know that? They have to run a test. Even if there's a cough, there are many bacteria that can actually make you to be coughing.
I know it's interesting because even this is the first time I'm knowing that
it's covered, right?
It's covered.
So that's just it. So they'll provide it in.
Honestly, we have a lot to discuss because this topic is broad, and owing to the fact that most people don't believe in health insurance, is a big tax, especially for the organization, the agency, is a big task ahead. So I think the organization needs to put more energy into making people understand the importance of insuring your health.
Sure.
Because a lot of people have that school of thought that you mentioned this earlier, that we are not praying for bad thing to happen.
Yes.
Why would I start insuring? Am I preparing for the rainy days? Stuff like that. But of course, if you don't prepare,
you need to prepare.
If you fail to prepare, you are failing.
Yes, of course.
So it's very important and sensitive. I don't think today will be enough for us to even discuss everything. So probably we'll take it layer by layer.
I think we have to do like episodes where we'll take each one.
Layer by layer.
Actually, what I wanted is that maybe we discuss maybe the formal sector, which is the NHIS that cover the federal government workers, or maybe we'll take the T-ship, that is the student aspect. I think, or maybe we'll take the G-ship, which touch individual people, the common people, the people in our locality, okay, and then that is what we call the organized private sector or the private plan. This one which talks about the organized private sectors. Those are like the banks and NGOs and any agency that is not government and is organized. So that's just it.
Also, I think the agency also needs to bring out more publicity in terms of people knowing medical facilities or medical centers that are certified,
like what we're doing
for national health insurance. So we need to know, the public need to know, so that they'll pick the ones that are closer to them, just as you've advised. And then finally, because of the situation we find ourselves in, we'll have to call it a day.
But
your final words in terms of national health insurance.
I think before he goes, he should just tell maybe a call to action where maybe someone wants to enroll you or get you on the NHIS.
NHIS?
Yeah, so that they will,
Okay. That is a contact number or something like that?
like we can maybe a site or where to connect to the
Well, it's very
platform.
easy. It's very easy. NHIS is online. You can just you don't even need to look for their website.
You
Just
search.
dial NHIS on your phone, NHIA or NHIS. It will pop up,
Okay.
and then you will see NHIS. Just go to your browser.
Which
and
one is the original site? You know, we have these are brothers. We're gonna go register insurance.
Okay.
We need to know the
Okay,
URL.
to be on the safer side, the address of NHIS office in Bauchi is just behind Magdala's. This Magdala's
Okay.
roundabout.
That their garden.
Yes, there's this there. Okay, they left that place and their garden place. Now
Okay.
they are just behind this Dogoyan roundabout, behind this Magdala's.
Okay, I get it.
Yes, they are just there. You see their signboard immediately before the first turn by the right hand side after
Yeah.
this Magdala's.
Alright.
You see one GRA All Boys Association, and then you
Okay,
see
okay.
NHIS
Yeah.
signboard there. Their office there. You meet them there.
Mhm.
It's 5 days a week. They are there. Believe me.
I also wanted to ask a question, but I guess I'll have to suspend it next time.
No, please.
Well, maybe a take-home question.
Okay.
Yeah. For example, let's imagine I'm providing health services. How does it work to be a national health insurance?
Okay, to be
service
enrolled
provider.
under-
How do I get myself enrolled?
Okay.
And who pays the bills?
That's the question. Who
All
pays
right.
the
You
bill?
see, it's very easy. Depend on the plan that you want. Okay. Before, that's the challenge that people are having. They want to enroll in NHIS and they don't know how to go about it. But there is no provision for them. That is why I tell you, NHIS started with what we call VC-ship, voluntary. First, it started as vulnerable healthcare insurance program, VC-ship. It's just for the vulnerable people in the community, in the country. And then later they changed it to voluntary. I remember when I went to Gombe to register somebody, his age parents, 2 of them. I registered them under this VC-ship. And then from there, they changed the name to Vital Health. Vital Health Insurance Program.
Or the
And
name
then now-
don't suffer.
The same VC-ship. And now it's another brand new one called GIS-ship. So now, like you, depend on if you're a student, you enroll under the T-ship. And the beauty of that T-ship is that once you are enrolled under it, you have cover, NHIS cover, nationwide.
Yeah.
Wherever you travel, because that's what we call out of station.
Okay.
You enjoy those services once you are covered under NHIS. Wherever you go in Nigeria, you're covered. Whether during session or out of session, you're covered, you're safe. Unless you're schooled and not into NHIS program. And then to answer your question, you can register with the SHIP program, which is 45,000 naira, and you have a window to add 2 more people.
No, I think my question is, as a health provider.
Okay.
As a health provider.
Well, when
maybe I own a clinic.
Yes, okay.
Yeah.
Okay. You see, as a health provider, I tell you the procedure of the registration is that you go to NHIS, show them your interest, you fill a form with them, you pay money for registration, and then you come to your facility, you give the address of your facility,
Okay.
you come to your facility, you check your facility, check what you have in the resources and other things, and then they know how to group you, whether they will give you, depend on what you have in your facility, that's the kind of the services that they will put you on, whether you can be able to provide primary services or up to secondary services. Then they accreditate you based on those services.
Okay.
They give you a license, a certificate, and then a number.
Okay.
So that number is what people are going to use. That is what is going to give you an identity apart from your name in NHIS. So during registration, they use that number and the name of the facility as your facility. That's just it. When people come to register, NHIS are not allowed to choose NHIS or HMOs are not allowed to choose a hospital to an enrollee.
Okay.
You don't choose a hospital. You always give him, the only thing maybe you do is ask him, where do you reside? You look at the proximity.
You give you something
Okay,
close,
then you suggest a number of hospital to him.
Close
He
by.
may ask you, okay, which hospital do you have? Or is this hospital covered under NHIS? Now you give him the list. He chooses. That's just it. So like you, if you're a healthcare provider that is a hospital, you go to NHIS, show your interest, they register, they check your facility. Okay, you have what they want. You meet the minimum requirement to be enrolled, to be registered as a healthcare provider. They register you. After they register you, then
Okay, once beneficiaries come and I provide services to them, when do I get reimbursed?
Okay, now how the scheme work is that, as I was saying, there are services that we call them primary services, and there are services that we call them secondary and tertiary services. Now, depend on the number of people that actually choose your facility to provide services. Once they choose your hospital, that is what NHIS called capitation. So they pay you based on the number of people that are under or they are registered as NHIS enrollees under your hospital.
Okay.
So NHIS will pay you monthly, whether they come to the hospital or they did not come to the hospital. NHIS will pay you this money
based on number of people
based on number.
enrolled.
Before the amount that they pay per person is 750 naira. Now, because of the inflation and other things like this, increase in the price of consumables, hospital consumables and drugs and other things like that, NHIS have to increase the number, the capitation to 1,200 naira per person.
Every month?
Every month.
Okay.
So you see, the higher the number of enrollees you're having, the higher the money you get as capitation. Now, this money is not just for you to eat it in your hospital or to spend it. NHIS is expecting you to buy drugs, to buy other tools, other things that you need in the hospital to fix them. Even if possible, to train your workers on NHIS guidelines. So that because once you do that, you register under NHIS, it is expected of you to have an NHIS desk officer in your facility. So that once any NHIS enrollee come to the clinic, that person will be the focal person, the first point. That's the person that will identify him, he will verify him. So this person will have the list of the people in the hospitals, and then he will be the one to open file for them. Once that person, an enrollee, come to the clinic, he will go to that NHIS desk officer, and then he will. Now, actually, once that is been done, NHIS will pay you money. Depending on the number of people you're having in your clinic, in your hospital. Each month they pay you that money. So this money cover your primary services.
Okay.
Because once you provide primary services, NHIS don't pay you, or should I say HMOs, Health Maintenance Organization, because Health Maintenance Organization are the one that they are going to be paying you this capitation, and then what we call fee for service. So fee for service is for services that are covered under secondary services and tertiary services.
Okay.
So actually we have some sickness or some ailment that are categorized under primary services, and we have those that are secondary, and we have those that are tertiary. So that is how.
For example, secondary, tertiary, quickly. We have less than 3 minutes.
Okay, now depend on the sickness. Like here, for example, like let's say all these surgeries, they may fall under secondary, and then all these other
Just a simple for the primary.
Okay, for the primary, well, all this UTI, simple UTI, unitary tract infection, RPI, respiratory, also tract infection, whatsoever. That's it. All this one, they are primary services. Malaria, they are also primary, unless we have something called severe malaria or anemia. Or all this one, they are primary services. And then that's just it. There are a lot of them.
You made mention of primary, a total of 1,200 being paid every month per person. What about secondary and tertiary?
Well,
it depends.
It depends. It depends on when an enrollee is sick and go to the hospital. That is when you will be. When he is sick and go to the hospital, and you provide services for him under secondary, under the secondary services. Before you provide those services, actually there is a procedure. First of all, he will go to the NHIS clinic. They will see him under primary services. That is, a physician is there. He will see him. They will run some tests for him, or they will do some things for him like this. And once they realize that, okay, this one is beyond primary services, he needs further treatment, or we need to bet this guy. Understand? So what they do now is that they will find a way to reach their HMO. That is their health maintenance organization. HMO, those are those companies, private companies that provide the NHIS services. Because NHIS actually don't provide those services. They allow private companies to provide those services, while NHIS provide the framework, the guideline for them.
The regulations.
The regulation, and then they are like the watchdogs. Understand? So actually that's what happens. So you'll find a way, maybe through a text, a phone call, email, WhatsApp, or any other means. They reach to those HMOs that are actually managing this. They are the HMOs that are managing this enrollee. So they will send them, they will communicate to them, okay, we have your enrollee with so number, he's in our facility, you want to access these so services. So we need authorization. That is, we need an okay.
Go ahead
For us to provide these services to this person. So now, and then once they send that, NHIS allow the facility in order, because the main objectives is to save life. So whether these HMOs send the enrollee, they send the referral code or not, they have within 48 hours to reply. But the facility can go ahead and treat that person.
If they don't reply,
provide those services to him before the court comes. Because we find a situation whereby there will be a delay in delivery of the court, and then an enrollee will be left unattended, which may result to some major crisis or some major happenings where an enrollee may even lose his life. So they provide those services. Now, what happens is that these HMOs, they give them the go-ahead, what we call authorization. They give them a code, series of numbers or digits or figures or whatsoever, as they wish to make it. They coded their code, they give it to the hospital. Now, the hospital will provide those services to this person. And then after they finish providing the services, at the end of the month, they'll take the list of the number of people that they provide these health insurance services. They will type it, and then they will send it with this authorization code. Okay, this Mr. A was on the hospital. Okay, what happened was that he's having an ulcer, PUD, pelvic ulcer disease. And then we refer him to secondary services on social debt, and then this is the code. Because once you're referring, before, there's a procedure for actually requesting for a code for a secondary or tertiary services. You have to tell them the clinical findings. Okay, once the clinical features, that is found out, and you give in the total. And please, let's not take our health on serious. Let's be serious with it. They say health is wealth. And then you can never tell when you are going to fall sick. Children insurance fine smoothly and perfectly. Thank you so much.
All right.
Thank you for having me. Thank you. It's a lengthy topic to do. So I think we'll organize more. So that the sensitization, even us as Adendo store here.
We need it.
We'll be sensitizing other people.
Yeah.
Thank you.
Actually, thank you so much for having
We're
me
very
here,
happy
London
to
store.
have you.
That's nice.
All right. Thanks.